Hello and welcome to Health Me Please channel. Today, we're going to be discussing about major depressive disorder. Major depression is a mental health condition that can occur as part of unipolar major depressive disorder or as part of bipolar disorder if the patient has a history of mania, mixed mania, or hypomania. It's estimated that the lifetime prevalence of unipolar major depression with psychotic features in the general adult population is 0.4 to 0.5%. And among individuals with unipolar major depression, approximately 28% have psychotic features. An episode of major depression is a period lasting at least 2 weeks, with 5 or more of the following symptoms. Depressed mood. Loss of interest or pleasure in most activities. Insomnia or hypersomnia. Change in appetite or weight. Psychomotor retardation or agitation. Low energy. Poor concentration. Thoughts of worthlessness or guilt. And recurrent thoughts about death or suicide. Patients with unipolar major depression typically suffer comorbid psychiatric disorders, including anxiety disorders, post-traumatic stress disorder, obsessive-compulsive disorder, attention deficit hyperactivity disorder, oppositional defiant disorder, intermittent explosive disorder, and substance use disorders. Comorbid personality disorders are also common, especially avoidant, borderline, dependent, and obsessive-compulsive. Depression and comorbid general medical illnesses often occur together, and the relationship is bidirectional, meaning that depressed patients usually have at least one general medical condition and patients with general medical disorders are often at increased risk of depression. Unipolar major depression with psychotic features is characterized by an episode of unipolar major depression that includes delusions and/or hallucinations. The symptoms of major depression in unipolar psychotic depression are more numerous and severe than they are in unipolar non-psychotic depression. In addition, suicidal ideation, suicide attempts, and comorbid anxiety disorders are more common in unipolar psychotic depression. The psychotic features are typically consistent with depressive themes of guilt, worthlessness, and hopelessness. The initial clinical evaluation of patients presenting with depressive and psychotic symptoms includes a psychiatric and general medical history, mental status and physical examination, and laboratory tests guided by the symptoms, history, and findings on the physical examination. A family meeting may help reveal delusions and hallucinations that are subtle, plausible, intermittent, or concealed by the patient. The differential diagnosis of unipolar major depression with psychotic features includes unipolar major depression without psychotic features, schizophrenia, schizoaffective disorder, and bipolar psychotic depression. If you or someone you know is experiencing symptoms of major depressive disorder, please seek help from a mental health professional. Thanks for watching. If you want to stay up to date with all of our latest videos, make sure to hit that subscribe button and turn on notifications so you never miss an update. Finally, we want to remind you that the information we provide on this channel is for educational purposes only. If you have any symptoms that you suspect may be related to a particular disease, it's important to see your doctor as soon as possible.